have with us today Dr. Keith Unger, and we're going to be talking about a topic that I think just about everybody is interested in. It has to do with female hormones, menopause, and female disorders. Welcome to the show, Doctor.
Thank you.
Menopause terrifies women, doesn't it?
Well, for some women it does, because it is a change in life, and of course it can come with a host of symptoms, and a lot of times those symptoms can be prevented if they do some testing prior to them going into menopause to actually balance out the hormones, and that's why some women can go through menopause basically with no symptoms, and other ones have major problems. But we have to realize that menopause is a natural transition, and it should happen naturally in the body, and it should not be a major problem for most women.
What's actually happening in a woman's body when she goes through menopause?
Well, when a woman goes through menopause, what's happening is actually, we have to realize that in a cycling woman, the hormones will go up, say estrogen will go up, and then it'll get a little bit lower, and then the progesterone will come behind it. That'll peak just a little bit after the estrogen. And what happens with women who are in menopause, the hormone levels are much more lower, and they're kind of constant throughout the whole month, so to speak.
Let's take a look at slide 6B, and maybe we can explain that one to us, if you could.
Well, basically, this is a female hormone panel that we run using saliva test, and the beauty of using saliva test is that we do 11 samples over the 30-day cycle. And so this particular graph is showing you that you can see that the estrogen, the actual top one there, it peaks up about mid-cycle, and then you can see it's going to kind of gradually go down. And what also happens is that right behind it is progesterone, and those two should actually come down together. Now, a lot of times with women with irregular menstrual problems or bleeding irregularities, a lot of times these two hormones become imbalanced somewhere along the cycle. So if the estrogen stays high at the end of that cycle and the progesterone is actually low, then that can actually start to cause a host of symptoms. The PMS, the heavy bleeding, the menstrual cramping, and all those things play a role. So by doing saliva testing, you get a much better clinical picture of what's going on. Now, in the next slide, if we take a look at the next slide, very quickly, this slide just basically points out that when women are in a perimenopausal state.
6C, slide 6C.
Yeah, and what happens in that particular instance is that basically the hormones are going to be a little bit lower, and you're going to get these little spikes along the way, and it's when you have these spikes that you may be getting your symptoms of the headaches, the bleeding irregularities, heavy bleeding. And we have to realize that perimenopausal can be defined as up to 10 or 15 years before you actually go into menopause. So it affects other people a little bit differently. And on the next slide, which would be 6D, basically on this slide, I just want to show you that you can see now the hormone levels are much lower throughout the whole cycle. And so that's where we are when people are in menopause. But what happens is that the estrogen and the progesterone ratio gets a little bit out of balance throughout that month.
Okay. Now, as you perceive menopause and changes in hormones, would you depict this as a problem, a challenge, a life process that isn't necessarily problematic, or always a problem for women? How do you perceive it?
Well, I perceive it as, yes, it could be a problem. It is a problem for many women, and we have to realize why that is. We have to realize that the hormone estrogen is rampant in a lot of foods. It's in a lot of cosmetics. And what happens is this causes an imbalance between estrogen and progesterone. Now, some women, as we said, menopause is a natural transition of life, and you should go through it very smoothly. But, if we look at our parents and grandparents, they kind of went through menopause a little more smoothly than most women are today. Why? Because these women are eating processed, refined carbohydrates, they're eating sugars, and these things throw us into what we call a state of estrogen dominance. And what that is basically we have too much estrogen in relationship to progesterone. So what happens there is that this estrogen dominance is what throws them into major problems and a lot of symptoms.
And again, these are perspectives on these issues from Dr. Keith Unger. Obviously, not every physician in America, MD or DO, looks at things exactly the same. You've said that there could be a relationship between foods that are consumed or exposure to certain things and what women go through with menopause. But again, our purpose in this show series is to give you a chance to hear what someone from the alternative medicine side has to say on these topics. Now, It's an interesting point that pharmacologists, people who develop drugs and work at drug companies, that sort of thing, will say that any given drug that's manufactured can have a little different effect in a given person. It changes from person to person. It's more than just a little difference. Some medications don't work for some people and some do. And I think that menopause kind of brings that out, because here we see a hormone shift. But how a particular woman is going to respond to that varies greatly.
Well, we have to realize what drives those women to the doctors, and we have to realize that a lot of times it's usually a symptom, and it may be the heavy bleeding that can't stop, the irregular cycles, maybe the constant headaches, maybe the night sweats, the hot flashes, and what happens is that the doctor will put them on, say, a synthetic hormone such as Premarin or progestins, and what happens is that basically isn't fixing the underlying problem. They're already in estrogen dominance. By adding more estrogen to their system is not going to correct the underlying problem. And let's look at how that, by putting someone on estrogen, how does that really affect the body? Let's take a look, because we have our hypothalamus and pituitary up here in our brain, and I like to call those things like our thermostats, okay? So when estrogen gets low, they kick on and tell the body to produce more estrogen. So when they put you on something such as Premarin, which is estrogen, and basically horse estrogen, which comes from horse urine, and most people don't know that, but when they put you on it, that's like taking a heater next to the thermostat in your house so your furnace doesn't kick on. So you have a problem with your furnace, you're going to put an electric heater by that thermostat, and so what it's doing is it's tricking the brain so your body doesn't produce more estrogen. But in all reality, that's going to throw you further into estrogen dominance, and you're going to have some more problems down the road. So we have to realize that estrogen dominance has symptoms, and those symptoms are our friends. They're not our enemies, and we need to address the underlying cause of the problem, not just mask it with dominant hormone replacement therapy.
What function do these hormones play in physiology?
Well, you know, they regulate the women's cycle. They play a big role in the physiology of course, birth and pregnancy. And of course, when they get to the end of their cycle, if the egg does not become impregnated, then it basically goes through the same cycle. And we look nowadays and we see these young kids, 15, 16 years old, they're having irregular cycles, they're having heavy bleeding. And of course, you know, the conventional practitioners, first thing they want to do is put them on a birth control pill. Well, we know that there is side effects to that pill. We know that it can increase the risk for breast cancer. That's been well documented. And so why don't we fix the underlying problem? And it could be related to their diet. We know that when you eat these processed refined carbohydrates, it upregulates certain enzymes, and that could cause those hormones to go more into estrogen when it should be going into something else.
About a year ago, the newspapers and national television press and radio were full of stories about the increased risk of cancer from the combination of progesterone and estrogen in treatment of menopause. Since that time, there has been clarifications. What was that story all about, and what's your read on it?
Well, the clarifications were mostly done by the media, but my thoughts on that is basically the numbers are there, the stats are there, you just read them. Basically, it was a study of 16,000 women. The study was supposed to run approximately 8 years. It ran for 5.2 years because the risks of what they were doing outweighed the benefits. So in other words, more women were having more problems, and whether it been pulmonary embolisms, coronary spasms, breast cancer, and a lot of these other things that they were finding in the study were downplayed by the media. And so, you know, go back and read the studies for yourself, and you can see that it did raise some issues and some questions where it felt that, you know, we need to pull this experiment because it's causing too many problems.